Something finally happened that hasn't happened in the past 2 years. I attended a conference where AI was not the biggest topic of discussion. Which conference was it? Let's get to it.
Sway Health.
Hello, Colin Hung here for Sway Health. I was in Boston for the last 3 days for the annual Patient Experience Symposium. The symposium is organized by ICD Events, and they have spent the last 8 years slowly building up this conference with more diverse speakers and attendees. This was my first year attending. I've always wanted to go to this conference, but it's always seemed to land on days where I needed to be somewhere else. I'm glad I was able to make it happen this year. Now, the first thing I have to say is that the keynote presentations were excellent, and they were not from your typical healthcare patient experience speakers. On day one, we had Josh Robinson. He teaches med students and frontline staff how to listen and work together. He uses drumming as the conduit for his lessons. At the symposium, Josh put together a drum line, and he taught us all how to drum in sync with each other. Day two featured a keynote from Tommy Whitelaw. He charmed the audience with his Scottish accent and with his gift of storytelling. He had so many lessons and messages in his session, but his most memorable was his plea to healthcare staff to remember that the patients they care for are people with incredible love and life stories. He used his own mother's story as an example, and by the end of it, there wasn't a dry eye in the room. Now, imagine if every patient had the chance to tell their life story to the staff that were taking care of them. We would have an incredible level of empathy and care. And that is what Tommy teaches. Oh, and he also led the audience in a dance to a Katy Perry song. On the last day, there was not one, but two keynote speakers. First was a fireside chat with none other than Dr. Geeta Nair, who we have interviewed on this channel about her book, Misinformation. One of her messages was the important role that healthcare marketers play in combating misinformation. And we should do it, not because it's just the right thing to do, but because misinformation is competing for patients. Whether that's a home remedy, a wonder pill, or some sort of new device, most of the claims that misinformation purveyors are pushing out there are specifically designed to keep patients away from healthcare providers. Dr. G wants us healthcare marketers to up our game and make accurate medical information as fun to consume as misinformation is. Day three also featured a fantastic keynote from Ed Marks. He is such a treasure. I love how he always speaks from the heart. He shared a slew of simple $0 tips to help teams become more patient-centered. My favorite tip was volunteer at your own organization. Yep, once a week over lunch, Ed recommends that you put on the smock and go be part of the army of volunteers at your organization. Not only will you have better empathy, you will also feel more connected at work, and you will likely identify dozens of ways that things can be improved. The panels and breakout sessions at the symposium were all great too. I enjoyed hearing how various organizations were helping their patients through their care journeys. There was even a panel of payers that spoke about member experience and wanting to work with providers in order to be more seamless. So, what are my 3 takeaways from the symposium? Well, my first takeaway was the most unexpected. AI was not a big topic of discussion at the symposium, and I think that's perfectly okay. In fact, I was inspired by it. Instead of talking about technology, all of the speakers and panelists spoke about the need to inject more humanity into healthcare. Sure, technology can help, but the best thing that tech can do is make it easier for those who work in healthcare to connect with those who need healthcare. My second takeaway was that the staff experience is becoming equal in importance to patient experience. Those two things are no longer seen as separate, and that is a great thing. You cannot expect nurses and doctors who are overworked or saddled with bad technology or who are put at risk because of aggressive behavior to deliver a positive patient experience. People just simply aren't wired that way. So it was really nice to hear speakers here at the symposium talk about improving both things. My final takeaway is that kindness is the new currency we want to use in healthcare. All of the speakers spoke about how we all have the capacity for kindness, and when we receive it, we are much more likely to pass it along. I spoke with a number of people in the audience, and quite a few of them had programs already in place that recognized acts of kindness. I'm definitely going to need more pink socks to hand out the next time I'm at the symposium because there was plenty of kindness to recognize. I want to thank the team at ICD Events for inviting us to come down and be part of the symposium. It was great to hear from so many passionate speakers who clearly want to improve the patient experience. I'm Colin Hung. Thanks for being here, and I'll catch you on the next video.